is it videotaped for?
I don't know.
Like 2 minutes maybe?
It's a 16 gig, so I don't know how much memory it'll do. It'll do.
I would think we'd do a lot.
Yeah.
Yeah.
And I don't have any song. I have 2 songs on here, so I don't have like much memory.
Hi. Come to a meeting? Awesome.
Meetings in these rooms, especially if they're Cerner meetings, always don't mean Cerner meetings. There's so much Cerner, I totally believe it.
Bridget, do you remember Sarah?
Yes, I do.
Well, Sarah has written a very nice letter and nominated you for the Daisy Award.
Oh, well, thank you. Thank you so much. So, I'll just tell a little bit about Daisy for people that don't know about it, and then we'll go into the presentation for your award. Congratulations. Thank you. So Daisy was established in the year 2000 by some family members of Patrick Barnes, and Patrick Barnes was a patient. He was 33 years old and he died of ITP. And so Daisy, the family got together and they wanted to do something special in his memory, and they created the Daisy Award. And Daisy stands for Disease Affecting Autoimmune Disorders. And the family, brainstormed about what to do in his memory. So anyways, the family just kept coming back to the extraordinary care that Patrick received while he was in the hospital, and how the nurses took care of him, both physically and spiritually. And so they came up with this award to honor extraordinary nurses. And as a result, over 5,000 hospitals in the United States and other countries now have the Daisy Award for extraordinary nurses. So, congratulations.
Thank you very much.
So
I couldn't
Lisa's
do it
just...
without everyone.
That's what they always say. So, Lisa's just going to read a little bit of the nomination for you, or the whole thing.
This comes from Sarah. It says, I am a nurse at the VA, which also has the Daisy Award, so I know what the Daisy Award represents. I had a son born at 37 weeks gestation on 12/12 at Women's Hospital. He seemed to be born healthy with no issues. Bridget was my nurse. My son started grunting, not bad, just different than he had been. Bridget was with us frequently, checking on him. He became more lethargic. She was in the room at least every 30 minutes. She called the NFP because she said her instincts told her something was not right. When he got to the NICU, they found he was group beta strep positive, which was a surprise since I was negative. His WBCs was 1.4. Dr. Seidel said that if he had not transferred, he would have died within a few hours. He is 6 weeks old now and is fat and healthy. If it weren't for Bridget's instinct, he would have died in my arms. RN knew her job and followed her gut. She treated the patient, not watching a machine. She used her critical thinking skills. I thank her for my son's life.
That's great. So we have a few things for you from the Daisy Foundation. The first thing is a certificate for the award.
Thank you.
And then there's a story, I don't know, there's a story about the cinnamon rolls. And when Patrick was in the hospital, his dad came up with the Cinnabon, and usually Cinnabon helps sponsor the Daisy Award as well, but these are actually Methodist hospitals. Which are even better than those. And we have a little person to probably verify that. But anyways, his dad brought up a Cinnabon, and Patrick asked if he could have a bite, and his dad, of course, gave him a bite of it, and he said, when he left, he said, is there anything I can bring back? And Patrick said, yes, I'll take a Cinnabon roll tomorrow morning, and in fact, bring one for everyone on the nursing staff. And so that's why there's cinnamon rolls. So we don't have a Cinnabon close. Like I said, we have our hospital make them, but we want to give you this cinnamon powder, and they like to refer to that as Daisy Dust. Then there's a Kleenex and these are usually come in handy. I usually rip these out and use them myself. And then a service pin for the Daisy Award. And then, of course, the Daisy statue, which is made in Zimbabwe by a tribe of people, and the Daisy supports their tribe by buying these statues, and each one is individually carved, and there's usually a name on the bottom, and so it helps both, the tribe actually, and obviously the listeners. So I think, and then there's just a little magazine in there for you, but I think that's it. So unless you want to say something.
God, last night so long. I don't know what it was. Being a nurse myself on that side of the bed, I see patients all the time coming and going and everything. Being a patient, you mean the world to me.
Oh.
Thank you for saving my son.
Well, thanks for everything you've done. My family being here and all the work that you guys have done. So nice. I'm so surprised.
Sue, do you want to say anything?
I'd just like to say that I'm very proud of our staff and everything that you do, and that you truly bring the meaning of care when you do things like this. And our patients obviously appreciate that, or you wouldn't be here. So thank you very much. It's a privilege to have you work with us.
Well, it's a privilege to work with everyone here. I'm very blessed and honored to be a part of the team.
Congratulations.
Thank you.
I'm very proud of you.
Thank you.